Hello. We are going to review a little bit about the observation hour requirement for the CSC program. In our program, and as per ASHA, we have to have 25 hours of guided observation by the student before they start clinical practicum, or for the post-bac folks before you start your graduate program. How do you get these hours? It's such a great question. You can obtain these hours in our own clinic here, off campus, or through Master Clinician, which is an online program. It's a subscription fee for you. We have access to therapy and diagnostic sessions, and those hours do count toward the 25 hours. You have to have this done again right before clinic here in our program or before graduate programs begin. The requirement is that the supervisor or the speech therapist that you are observing has to have their ASHA certification that's current, and they have to have 2 CEUs of supervision or clinical instruction. So they have to have 2 additional course hours in this area in order for those hours to be valid. This is a new requirement in the last year, so we have to, when you are working with someone off campus, just making sure that they have those extra credits. If they don't and they're interested in these hours, I do have a free course that I'm happy to send them. This is a one-time class if they are interested. I've attached in the email all of the forms that you need, including the guidelines, the on-campus observation log, which is where if you were observing in clinic, you would document that time. The off-campus form, which includes some boxes for time, location, and clinical signature. The summary observation form, I'm just going to show it. This is the summary observation form. That is for in-house observations. This helps with the requirement as it is guided. You will be taking some notes. You will show that to the supervisor. So if I'm the supervisor of the client, you're going to show me your notes. We might have a couple questions or discussion, and then I will sign off on the observation record log, which is here. If you want to save some paper, using this form to watch maybe the same client in 1 week, so maybe 2 sessions of the same client and writing on the same form, just indicating different dates. A lot of students will do that just for ease of reducing paperwork. So the observation needs to be done here in room 022, and then or in the bigger rooms that have the 2-way mirrors or in the hallway of 024. You can log in and pick the room that you want. That's going to be indicated on the observation board right next to the men's restroom. You're going to sign up for a slot, show up. Please sort of be dressed for clinic, or at least, don't roll out from the gym and come to observe. You'll be sitting with other caregivers and parents, so be aware of that. There are headphones for you to put on, and then we ask that you don't move the cameras because the supervisors are also watching and they will move cameras if needed. So it seems like a lot of organization for you to keep all this paperwork straight, and it is. You have to maintain these records. It's required for clinic and for graduate school. I tell students to take pictures a lot or make a copy and scan it as a PDF every now and again so you don't inadvertently lose it. When the students move from the dorm to an apartment, sometimes we lose paperwork. So just keep this in a safe location. So this paperwork, all the paperwork for observation will be attached to this email. Please read it over. Please keep it in a safe place. Flag this email, save the documents to the cloud, however you need to do that. I'll also have hard copies of this in the rack next to Dr. Fulbrook's office, or 041, office 041, in the lower level of CPS. You're getting this video now, so you can begin this process. If you have additional questions, you can come and see me. I'm happy to talk to you about this. but all of the directions are here. Keep it in a safe place. And this is a great way for you to start seeing how some of the things you're learning in class can transfer and translate into clinical practice. It helps you to become a really great observer and helps you to think about what it will look like for you when you are in that clinical setting. Those students who are pursuing audiology and know that they are pursuing audiology, please come in and see me, and we can talk about what those observation hours are going to be for you. It might be more of a mix for speech and audiology. So the requirement for you for observation hours is the same on the graduate side. But it is for clinic, so we'll talk about it. So come and see me if you're an audiology student. We'll figure out what those hours can look like for you. Again, if you have any questions, please don't hesitate to stop in. I'm in 036 in the lower level of the College of Professional Studies. You can also send me an email. Just indicate what your question is about so I'm not completely confused, because that happens sometimes. So again, this is start early. You can get it done. If you do more than 25 hours, that's just a bonus for you. But we do require these hours for clinical practicum. And I will talk with all of you again, usually in CSD 360, which is the clinical methods class. We'll have a conversation about clock hours as well. All right. Thank you.